Hi, this is Vanessa. I'm going to begin with my landmarks. I'm going to start with the deltoid, roll up my sleeve, locate the Ackerman process, place my pinky on top of there, my other fingers down, separate my index finger from the other three and form a triangle, and I put the injection in the center of that triangle. Intradermal, and put one of my hands in the bending of the arm and form an L, the other on top of the wrist and form an L, and I put the injection in the center of that rectangle. Moving along to the Vadas lateral, have the patient to move the leg to locate the joint of the greater trochanter, and I put the palm of my hand on that, on the greater trochanter, form an L, locate the lateral femur, put my hand there, on top of that, form an L, and I put the injection in the center of that rectangle. Moving along to the ventrogluteal. Locate the greater trochanter, put the palm of my hand there on the greater trochanter with my thumb point to the groin, my index point to the axillary. Locate the iliac crest. My other three fingers, I'm going to separate them from my index finger, form a triangle, and I put the injection in the center of that triangle. And that concludes my landmark. Moving along to my patient. This morning I have Jonah Doe, date of birth 6/22/55, hospital number 006, and she's getting insulin NPH 10 units sub-Q, insulin NPH, insulin regular 5 units. I have my regular insulin. Rosifin 500 milligram IM. Rosifin 500 milligrams per milliliter. Tuberculin 0.1 milliliters ID. So I have my tuberculin. Now I'm going to take my meds back to my area to get them prepared. Hand hygiene. And with my first, we have insulin NPH. This is my insulin NPH. And we have 10 units of that sub-Q. And insulin regular 5 units sub-Q. This is my regular. I'm going to take the top off of those, because I'm going to draw those up together. I'm going to roll my NPH to make it cloudy. And it's cloudy. I'm going to wash them off vigorously. Get my needle. We got 10 units of NPH, so I'm going to get 10 units of air. Put it into the NPH. And 5 units of regular insulin, so I'm going to draw 5 units of air. Five units of air. Put it into the regular. I'm going to draw up 5 units of regular. Then I'm going to draw up 10 units of NPH. And I'm going to have a total of 15 units of insulin. I have 15 units of insulin. I'm gonna scoop up my top. Get a bag for that. Drop it in. I'm gonna label it NPH 10 units sub Q, R for regular, 5 units sub Q for Jonah Doe at this given time. Next we have Rocephin. Rocephin 500 milligram IM. And take the top off of that. Wash it vigorously. Get my needle. Take the top off. And we need, it's 500 milligrams per milliliter, so I'm gonna draw 1 milliliter of air. Put it into the bottle. And I'm gonna draw 1 milliliter of Rocephin. I have 1 milliliter of Rocephin. Scoop up my top. Get a bag for that. Drop it in. Label it Rocephin 500 milligrams per milliliter IM for Jonah Doe at this given time. Next we have tuberculin 0.1 milliliters ID. So this is my tuberculin. Take the top off that. Wash it off vigorously with an alcohol pad. Get my needle, take the top off. 0.1 milliliters, so I'm gonna draw 0.1 milliliters of air and place it into the bottle. Then I'm gonna draw 0.1 milliliters of tuberculin. .1 milliliters. Scoop up my top. Place it in the bag. Label my bag tuberculin 0.1 milliliters ID for Jonah Doe at this given time. And now that I have my meds prepared, I'm gonna go to the patient room. Hey, how you doing? I'm Vanessa. I'm gonna be your nurse today, and I have 3 injections for you. Can you state your name and date of birth? I'm gonna compare it to the armband, Jonah Doe. Date of birth 6/22/55, hospital number 006. Do you have any allergies? No. So that matches my papers. And hygiene. I have 3 injections for you this morning. First, we have insulin. So we have insulin NPH 10 units sub Q, insulin regular 5 units sub Q for Jonah Doe at this given time. And since you weigh 180 pounds, I'm gonna go in at a 90-degree angle, like a dart, and wash the area off. Let it dry. 90-degree angle, like a dart. Secure the needle. Push the insulin in slowly. Wait 10 seconds. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10. Take it out. Discard of the needle. Put a band-aid. Take off my gloves. Hand hygiene. And some more gloves. Next we have Rocephin. Rocephin 500 milligram IM for Jonah Doe at this given time. Take it out. And I'm gonna do this one like I did the insulin. 90-degree angle, like a dart. Clean the area off. Allow it to dry. And I'm going to change my needles. I don't have another needle, so I changed it. Go in, pull the skin. Go in at a 90-degree angle, like a dart. Secure the needle. Push it in slowly. Gonna aspirate. No blood. Give it a minute. Take it out. Activate my needle. Discard of it. Put a band-aid. Take the gloves off. Hand hygiene. Some more gloves. Now we have tuberculin 0.1 milliliters, tuberculin 0.1 milliliter ID for Jonah Doe at this given time. I'm gonna wash the area off. Do bevel up 15 degrees. Discard of it. I'm gonna draw my circle. There it is. And this will be read in 48 to 72 hours. I'll take my gloves off. Hand hygiene. I will clean up everything. Make sure the patient don't need anything. Bed at lowest position, call bell and reach. And now I will go to my documentation. I will document, and my documentation will read 4/18/20 at 0800, finger stick blood sugar 165, insulin NPH 10 units, and regular insulin 5 units, Administered sub-Q in upper right quadrant of abdomen. No bruising noted. Bed lock at lowest position. Bed rails up ×2. Call bell and reach. Reminded patient to call for assistance out of bed. Sign V Cotton RN. 4/18/20 at 0900. Explain reason for a TB scan test. Patient verbalized understanding of test. 0.1 milliliters of tuberculin protein, lot number 24246, injected in ID in right forearm. 1-inch circle drawn around the billet. No reaction noted. 5 minutes after injection. Informed patient test will be read on 4/21/20. Instructed patient not to apply lotion, cream, or scratch to the site. Don't scrub or apply bandage over it. Signed V Cotton RN. For my IM, 4/18/20 at 0910. Rocephin 500 milligrams. Administered IM in the right ventrogluteal site. No complaints of numbness, tingling, or pain. Signed V Cotton RN. This concludes my medication administration.